everyone, welcome back to Medical Mondays. Happy Monday. Today we're going to talk about the gastric bypass, both as a surgical option for weight loss and for gastroesophageal reflux disease. Okay, so what is a gastric bypass? Well, first of all, the gastric bypass was first used as a weight loss operation by Dr. Mason and Dr. Ito in 1967. In the 50s, they used the bypass after a patient had surgery for gastric cancer. And sure enough, these patients 6 months, a year, 5 years later had lost a lot of weight. And so it became a weight loss operation. The gastric bypass involves two parts of the operation. In the first part, we're creating a small gastric pouch. So we've taken a 2-liter stomach, a capacity of 2 liters, and transformed it into a 50-milliliter gastric pouch. That's the restrictive part of the operation. The second part of the operation is the actual bypass. So we reroute the intestines so that food is going through one part of the intestine, your acid and your enzymes are going through another, and they join after a certain amount of the intestine is bypassed. And that's the malabsorptive part of the operation. So let's talk about why a gastric bypass is good for reflux. Reflux happens for 2 reasons. The main reason it occurs is because of patients having a hiatal hernia. So you have to fix a hiatal hernia if you're going to do a GERD operation when it comes to bypass. The second reason is the amount of acid that the stomach produces that goes up into the esophagus. So imagine you've taken this big stomach that creates a lot of acid and you've created a 50 milliliter pouch, particularly part of the stomach that doesn't create that much acid. That's the only part of the stomach that's now connected to the esophagus. So now you have a much smaller volume of acid that is capable of going up into the esophagus. Okay, so now who's the right candidate for a gastric bypass in patients with GERD? I wrote a paper with other surgeons across the country as part of a foregut committee, and we showed that patients with a BMI 40 and even a BMI of 35 or higher, it's essentially a no-brainer to do a gastric bypass versus a fundoplication for acid reflux. Even patients who are 30 or 40 pounds overweight who have severe reflux, the gastric bypass should be considered as a primary procedure for anti-reflux operation. Well guys, thanks for tuning in again to Medical Mondays. I hope you all have a great Monday and a wonderful week. We'll see you next week.